Family Planning Association of India, Nagaland branch per Kohima di July 23 din 75th anniversary lagan nam di Kushimanaishe. Celebration program do Muskan Youth Center di Lushe good day special guest to Chief Medical Officer Kohima Dr. Liam Ne Konyak Tageshe. Dr. Konyak pra program di kota kura humoy National or State FPA India branches laga pioneers kange achievement karne praise krishe. Dr. Konyak Pragushage Association 75 years of existence celebrate kura milestone do FPAI ekla karne nohoigina Nagaland karne bi ekta significant ase. Idui nohoigina association bra gender-based violence komti kura aro magikan laga economic status pal karne Dr. Konyak pra acknowledge krishe. Dr. Konyak Pragushage family planning services laga importance to pregnancy related health risk prevent kribuli infant and maternal mortality komdi kribuli aro HIV AIDS bimar prevent kribuli kanase. Details I saw.
Today marks a significant milestone in the history of FPAI India. For 75 years, we have been dedicated to promoting reproductive health and family planning, empowering individuals and communities to make informed choices about their health and well-being.
The milestone is not just a testament to our enduring commitment, but also to the collective efforts of our dedicated team, supportive partners, and the communities we serve, and most of all, volunteerism. Today we come together to reflect on our journey, celebrate our achievements, and renew our commitment to building a healthier, more equitable world for future generations.
Recognizing the need for public education and community engagement, FPA India emerged as a key partner of the Government of India, instrumental in successful advocating for including family planning in the country's first 5-year plan 1952. Under the leadership and vision of Lady Dhanmati Rama Rao and Ms. Akabai Wadia, FPA India adopted a decentralized, community-based approach. Youth-centric initiatives. This Top Legs is an initiative of the branch at improving adolescent, SRH, education and empowerment, where young people come together at jam and jam, showcase their talents and skills.
So celebrating glorious 75 years. Here, as you will already know with the brief that leaflets that we have given, established in the year 1949 to promote family planning, and evolved as a national voluntary organization working for sexual reproductive health and rights. Then there was an advocacy success. That was in the year 1951, the first 5-year developmental program plan was by the government of India was the acceptance of family planning. Our vision, mission, and impact, legal data in the year 2023. But most importantly, our vision is impacting lives, upholding sexual reproductive health and rights, sustaining social well-being, and our mission being committed to advancing sexual reproductive health and rights, gender justice, diversity and inclusion for all, especially the marginalized and vulnerable, driven by young people. This is where volunteerism by young people that we emphasize. Powered by sustainability and accountability. We may have lots of ambitions, but if we don't have that fun, we don't have that grant, then we're gonna die. So all of us working in development sector, in NGOs, we must now begin to think about sustainability and at the same time be accountable to the funds, grants that we receive as well. That trend has to come. And of course, the year 2023 little data that we have is total unintended pregnancies averted. As you see the number, 2,84,029. Then unsafe abortions averted, 1,22,191.
1/3 of women give birth before the age of 20 years, and delivery with a total delivery of women under before the age of 20 annually, with delivery of with 1/3 of women will like give birth before they reach the age of 20, and annually around 15 million adolescents give birth before they reach the age of 20. 5 million adolescents are said to have unsafe abortions, of which 70,000 are related to abortion deaths through the government or even through NGOs. When you look at the adolescents in terms of emergencies, especially adolescent girls are more prone towards vulnerable towards rape and sexual exploitation. For adolescents who are sexually active, in terms of crisis, they may not have access to family planning services as well as sexual reproductive services. So in such cases, they are more likely to practice unprotected sex, further leading to more HIV as well as STI and unwanted pregnancies. So in some cases, adolescents might even be separated from their families. So like they are more vulnerable to sexual exploitation. Hence, in such cases, because of their limited life experience, they might not understand the nature of abuse as well as exploitation. And in order to meet their family needs, they might resort to selling sex in order to meet their family needs. So in order to avoid such scenarios, we can apply these following objectives. The second objective is on prevent sexual violence and respond to the needs of survivors. Engagement of communities. When we talk about engagement of communities, when we look at the society, they usually tend to be judgmental. So with the help of communities, by educating them and bringing awareness, we can reduce stigmatization as well as discrimination.
Family Planning Association of India is a voluntary, non-governmental organization which was established and pioneered the family planning movement in India. The association worked on a wide range of sexual and reproductive health and rights issues, encompassing family planning, maternal health, child survival, HIV/AIDS, safe abortion, reproductive tract cancer screening and prevention, gender empowerment, and young people, and mitigation of gender-based violence. Providing livelihood opportunities for economic empowerment of the poor and vulnerable, and advocacy for policy change at the national and state level. The key strategy of Family Planning Association of India includes ensuring access to high-quality sexual reproductive health services and strengthening access to information and service to young people. Comprehensive sexuality education and capacity building of health care providers and community volunteers on sexual and reproductive health issues, engaging with communities and individuals to change gender disparity and promote sexual and reproductive health and rights. Providing livelihood opportunities for economic empowerment of the poor and vulnerable and advocacy for policy change at the national and state level. Association of India, I sincerely congratulate and thanks to the association for empowering people, for transforming gender norms and power dynamics to promote gender equality, reduce gender-based violence, and improve the economic status of women and other vulnerable groups through their tireless effort and valuable family planning service rendered to the people of Nagaland. As the association celebrates those momentous milestones of 75 years of existence, it can be said that it is not only a milestone for the association, but also for the state of Nagaland.
Emporium Nagaland is India's premier aviation, hospitality and cruise line training and international job placement consultancy. Trained and blessed over 20,000 youths from Nagaland in prestigious international brands. The only institute in Nagaland that hosts top airlines, cruise and 5-star hotel campus interviews. The first institute to conduct international cruise campus interview in Northeast. We are open to students of class 10 and above. Emporium provides 100% placement assistance, empowering educated unemployed youths with global opportunities.